And Assalamualaikum, my name is Ummu Hafizah Binti Rahman. My matric number is 144264 and I am from Group 4 LSP402. So today I'm glad to share about one of the rare disease stated by National Organization of Rare Disease called hyperhidrosis. Okay, I'm one of the patients diagnosed with hyperhidrosis. I suffer and experienced this hyperhidrosis since I was 10, and I struggled for more than 10 years before I decide to seek help from the physicians, and I just undergone the endoscopic thoracic sympathectomy, which cardiothoracic surgeon performed the surgery on my side chest. Okay, first and foremost, I will explain about the introduction of hyperhidrosis. Okay, hyperhidrosis is the abnormally excessive sweating that is occur regardless to any heat or exercise. Okay, normal people get sweating for certain type of condition, such as getting nervous for taking exam or waits for examination result. But however, people with hyperhidrosis may experience unnecessarily excessive sweatings regardless to any kind of situation. For example, they can even sweat when they are watching TV, standing in the cool room, or even when they are writing. And then hyperhidrosis also produce a lot of unhappiness and embarrassing when the sweat from your palms start to wet your exam paper and your clothes start to wet all over your body. To cover all this kind of obstacle, people with hyperhidrosis usually bring a packet of tissue or wearing a dark clothes, but it's just a temporary solutions. And then hyperhidrosis, there are two types of hyperhidrosis. The first one is primary hyperhidrosis. Primary hyperhidrosis refers to the excessive sweating that is not caused by another medical condition, and it occur on the specific area of the bodies, and it is asymmetric, which means that both left and right side of the body affected similarly. There are three subtypes of primary hyperhidrosis, which are axillary, palmar, and plantar hyperhidrosis. Primary hyperhidrosis may develop during adolescence and adulthood, and then it may be inherited. And then the second one is secondary hyperhidrosis. Secondary hyperhidrosis refers to the excessive sweating that is occur due to another medical condition such as hyperthyroidism or other side effect of medication. People with secondary hyperhidrosis experience excessive sweating in larger area of the body, such as abdomen, thigh, and also the back. And then secondary hyperhidrosis may develop during adulthood when the people start to develop any disease. And then there are the causes for primary hyperhidrosis is still unknown, but the research is still going on. For secondary hyperhidrosis, it may caused by another medical condition such as spinal cord injury, diabetes, and obesity, and also the hyperthyroidism. Hyperthyroidism means that your thyroid gland is overactive and produce too much thyroid hormone. And then since for signs and symptoms for primary hyperhidrosis, the onset of the excessive sweating is earlier than age 25, and the people with primary hyperhidrosis will experience clammy or wet hands, feet, and armpits, but the body usually stops sweating during sleep. For secondary hyperhidrosis, the entire body sweats excessively, but sometimes only part of the body, and the sweating is also occur during sleeping. And then for diagnosis, the first one is physical examination. Physical examination means that the doctor will ask about the family history of sweating and which part of the body that sweat a lot. The second one is sweat test. Sweat test involve applying the powder on the skin, and then the powder will turn into purple color when the skin get wet. And then the third one is thyroid test to investigate the hypothyroidism, and then the last one is urine test. And then there are few possible treatment for hyperhidrosis. The first one is iontophoresis. Iontophoresis involve iontophoresis is only possible for palmar and plantar hyperhidrosis, which hand and feet will submerge in a void of water, and then the panless electric current will apply on the water. And then the second one is Botox injection. Botox injection will inhibit the nerve that trigger the sweat gland. The third one is anticholinergic drug. Anticholinergic drugs such as oxybutynyl chloride will inhibit the parasympathetic nerve. The last one is endoscopic thoracic sympathectomy, which also known as ETS. It is only recommended when the patients not respond to other treatment. ETS is performed under the general anesthesia, and 1 to 3 nerve that trigger excessive sweating is cut. And then there are few side effects for the treatment. For iontophoresis, patients may experience dryness. For Botox injection, it will produce or develop allergic reaction. And then for anticholinergic drug, patients will experience dizziness, constipation. And then for ETS, it will cause the patients may develop the side effect of the compensatory sweating. Okay, last but not least, we realize that modern technology developed day by day to improve human health, including to reduce the side effect for post-treatment. We are the one who responsible for healthy life, should aware to any sign of abnormalities that occur. We should know when to seek help from the doctors to prevent any obstacle in order to keep our life going smoothly. And then we should never feel offended with if the people around us start to ask about our health condition. This is because it is a sign of concern, as community should do. Okay, that's all from me. Thank you.